So another little video on Voodoo Flossing, but we're going to look at, so we just made a video on the elbow, we're going to look at the knee, because the knee often, or around the knee, can get quite tight, so we're going to use Benji again. So we're going to go and work on his, which one's your worst leg?
Probably the right leg, actually.
Right leg, okay. So first of all, so again, you start distal from the joint, so distal from the hip, which is always going to be lower down. So I'm going to go and use this weaker one on there. So I've got two voodoo bands, and what I'm going to do is exactly the same thing as what I did in the elbow.
Do you want me to tense my knee?
No.
Okay.
So you go about 70% tension again. Just wrap it round. Just work on these kind of areas, and again, it's the reason it works so well is because it's that global compression, so it's compressing all the way around the joint.
Yeah,
well done.
You can already feel that.
Yeah, you'll always feel the pressure. That's a really good sign. And then I'm just going to wrap this up quite lightly, and then I'll tuck it in.
Quite light.
Yeah, it is quite light, but the pressure builds up because it's on top. And so now we're going to do this quad. Okay. So, don't worry, it won't be on for long, mates. So it's going to go on here. So again, you start over the top of the knee, and just make sure it's anchored in, and then pull it in tight. Once that is done, you can go around. Now quads, obviously, they can take a beating, so you can do the upper leg with a bit more tension, because they're such big muscles, they need a lot of delaminating. It's why it's going to be sore.
That's all from all the front squats we do.
Yeah. So, well done, mate. Right, so then put that underneath, hook it underneath it. Right, now so I want you to go and do 5 to 10 air squats in front. I'm going to flip the camera around. I'm going to spin it there. Okay, so we're going to watch how Benji does. He's going to push his knees out really hard. He's going to try 5 to 10 air squats like this. Okay, and so the importance of the movement is that he's forcing the muscles to move, the tissues to delaminate, because that compression that he's got on the soft tissue around there. And you're just going to push those knees out, wiggle those toes. Okay, do a couple more. Sit in the bottom, push your knees out a bit more. Good, stand up. Okay, last rep, go back down, push the knees out. Good, stand it up. Excellent. Okay, and then what we're going to do, we're going to put him out of his misery. Take it off. Get the band off.
It feels really good after, I do have to say. It does feel really good after.
So you take the band off, and then decompress. Okay. All right. Okay, now what Benji will do is we're going to look for some change. So the big thing with this is change. So, right, show me a few air squats now, and push those knees out. Now, I don't know about you, but that looks a bit better, a bit easier. How does the left side feel to the right side?
It's good.
Yeah? Yeah, and then also, if you look, guys, it's all red. So like all of that is new blood going straight into the tissues. But if you have any knee pain or anything, this can be really, really good, especially if you've been doing a lot of hard training. Yeah, can be a couple of bruises, but it's a very effective tool. Doesn't need to be complicated. Again, it's a cheap little thing to get hold of, but those are two joints, elbows and knees, that really benefit from global compression. So I hope you find that useful. If you've got any questions, post them in the comments, and we'll see you again soon.